Today, we are lucky to have a wonderful guest in Dr. NISHANT Kumar Srivastava, and he is working as a consultant in Ministry of Women and Children, NIPCC, the Lucknow, and is working as an honorable guest lecturer at Solanki Homeopathic Medical College, Shimla, Himachal Pradesh, and he has done so many has won many awards nationally as well as internationally, and some of the awards are Bharat Homeo Ratna Award 2023, Hanuman Award 2023, Homeo Gaurav Samman 2023, Homeo Icon Award, Rashtra Guru Rashtriya Ayush Guru Samman 2020. There's so many brilliant awards winner, and he is a specialist in the field of skin, kidney, renal disease, psychiatric problem, arthritis, and pediatric cases. So many. So that means that he is a multi-specialist by all means. Today, sir will be presenting a very good subject, evidence-based clinical study on homeopathic dermatology. As you all know, that every homeopath gets at least one or two cases every day from dermatology, and we can manage it very well. So, sir is about to speak about the relevance or importance of keeping evidences, so that we can reach to the public and homeopathy, what homeopathy can do to different condition in dermatology. We are very happy to welcome you to this stage. Welcome, sir.
Thank you. Thank you. Thank you very much.
Yes.
Can I share my screen now?
Yes, already shared.
Already shared?
Yes.
PPTs are coming?
PPT is not yet coming. All the front page is yes, it is coming.
It's coming?
IFPH stock, the first page has come.
Yeah. 1 second. I'll just see if the PPT is coming. PPT is coming?
Yes, only the first page has come out.
Okay.
1000. Yes.
Yeah.
Please put in the slide. Sure,
Yeah.
sir.
Is this clear? Is this clear now?
Yes, sir. Yes.
Okay. Can I start?
Yes, definitely.
Okay. Thank you very much. I first of all thank International Forum of Promoting Homeopathy, and I want to congratulate the organizers and the doctors who have put in such a tremendous effort for so long, and conducting this webinar. It is the 1304th daily webinar, and I must congratulate. It's a tremendous effort from everyone to promote homeopathy at every level. And I'm very fortunate, I'm very glad, I'm very honored to be here and to present my work in dermatology. I've been working on dermatology for very long, and from last 15-20 years, I've always been very much very much concentrated my study and my research only on dermatology. Now people have started recognizing the importance of dermatology. Although, as you have said, that in every practice, in the even in the beginner or in the a seasoned practitioner, 50 to 60% cases of dermatology comes to the OPD each and every day. Okay, but this dermatology has never got that much of importance. Now presently in the present scenario, even National Commission of Homeopathy recently has started MD dermatology, and it's a great news. And I'm delighted to know that the dermatology is getting its due, especially for the youngsters and the beginners who start their practice, and they come across maximum number of dermatological cases. Even when I started my practice, the dermatology was not so much into the main highlight, but now things are changing, and dermatology is getting its due. And as we all know, homeopathy in homeopathy, according to Dr. Hahnemann, sir, health is supposed to be the balance between mind, body, soul, and spirit. Okay, so every disease, maybe a dermatological disease or any disease, okay, it is the imbalance of the vital force which is caused by certain discrepancies by due to an imbalance in the vital force, and we come across various kind of diseases. It can be mental disease, it can be a dermatological disease, it can be a physical disease, it can be a psychosomatic disorders. Okay, and most importantly, I want to tell about dermatology is, whenever you are suffering from any disease, okay, maybe like any disease, cancer or anything, you have to tell the other person that, see, I am suffering from this disease. But in dermatology, you cannot hide the disease. The basic thing that is already, it is there in the arena. Everybody knows that you are suffering from a psoriasis, from a vitiligo, and there is so much of stigma attached. You cannot hide your disease. In other diseases, you can at least hide. And in this, it becomes so prominent that you are suffering from dermatological diseases, especially autoimmune disorders, which have been working on, like psoriasis, vitiligo, lichen planus, etc. Now, we know that our mind is the basis of, is the origin which creates the itch, the sora, which creates a disease, right? So what happens in the mind of a man is always reflected in the disease of his body. Okay, take care of your mind, your body will thank you. Take care of your body, your mind will thank you. So now we have started giving importance to psychosomatic disorders. Our master, Dr. Hahnemann sir, 275 years ago, he recognized so many things about the origin of the disease, which is from the mind. And now the modern medicine has started recognizing as it is as a psychosomatic disorders. Okay, so we have been working, we have been fortunate that our master has already given so many things, has already given the origin of the disease, which is from the mind. And you have to know, your knowledge has to be there, your proper diagnosis has to be there, then only you'll be able to tell which disease is this. Okay, so diagnosis, knowledge is very important. Okay, eyes only see what the mind is prepared to comprehend. If you know certain things, then only you can recognize anything. If you don't know anything, if you don't know about the diagnosis, the patient will come and you will misdiagnose. In dermatology, I've seen so many doctors have been, they just say that it's an eczema, it's a dermatitis, without getting to the proper diagnosis of the patient. So we should have all the knowledge, the disease knowledge, the knowledge of repertory, materia medica, then only we'll be able to treat all this. And we all know stress makes ourselves sick. Okay, stress, चिंता जो होती है वो चिता होती है, right? तो चिंता ना करें, चिंतन करें. Okay, just stress is important. Okay, we need to how to deal with the stress, and stress causes the origin of the disease. Hormonal imbalance, the stress, the limbic system, as we all know that our emotional centers is a limbic system in the brain. Okay, and brain in itself controls our hormone. Okay, it creates a balance, and then everything is in harmony. If this balance is disturbed, then we get a disease. Okay, then the disease comes up. This is psychoneurohormonal axis. Every part of the body is governed by our hormones. Okay, and our limbic system governs our hormones, and you can see how different systems are affected in by various hormones. Okay, like liver, blood pressure, pancreas, etc. And every emotion is a combination of various hormones like happiness, love, anger, anxiety. Dopamine is there, serotonin is there, oxytocin is there. Every emotion has a mixture of many hormones. Okay, so this is important to understand that our emotions in turn create our diseases like autoimmune disorders, rheumatoid arthritis, SLE, psoriasis, vitiligo, Alzheimer's, etc. Now, glowing skin is always in. Everybody wants a good skin, right? So if it is very prominent in the present scenario, everybody is bothered about how he or she looks. Okay, looks has never been so important till date. Nowadays, people are very conscious about your look, your presentation. You might be very good, but if your presentation is not good, then it's all, it's all worthless. So skin symptoms, we can see from the skin, we face acne, rashes, bags under, our the skin, and our central stress response, you can see from hypothalamus, pituitary, ACTH hormone, the skin, and the peripheral stress response on the skin, on the sebaceous glands, skin nerve endings, and various organs. In this slide, you can see how the stress creates a lot of diseases in ourselves. Now, this is important to understand that this is very important to understand that every part, every emotion, every hormone is directly related to our skin diseases, right? So I'm coming directly to a model case which I want to present. You can see this is the latest case of a psoriasis. Okay, and you can see the amount of flaking in this patient. She's 49 years old, female, and she has been suffering from psoriasis, scalp psoriasis, for very long. And you can see the condition of the patient. The patient is suffering from extreme dandruff, itching, flaking, etc. And when the case was taking, I just want to tell you that all these cases which I'm showing, they are very long cases. But because the time is limited, I have, I have contained it into certain rubrics and repertory chart, and I've tried to justify my prescription, and then will show you the results of the prescription. So in short, I want to show you maximum number of cases, as much as I can show in this presentation, so that we can get good idea of what homeopathy can do in dermatology. So in this case, confusion of mind, laziness, mathematics inapt for sympathetic, artistic, emotional, desire cold food and cold drinks, consolation ameliorate, and travel desire for. So in this case, the main thing which I got was the confusion and laziness, and with that there is artistic nature, emotional amount of that person, and desire of cold drinks and cold food. That is important. Travel desire too. And when the repertorization was done in this case, there was a clear cut seeing that calcarea force, although in our repertorization has come very low in the in this our repertorial chart. Calcarea, it is, this patient is having a lot of calcarea elements also, but phos elements also, right? But in totality, when I come across, then you see that this patient is having a symptoms of calcarea phos, which came into the repertorization pretty low. But repertory is only suggestive, right? The final court of materia medica, the final court of justice is materia medica. So materia medica decides which medicine has to be given. And the best part is that we have to understand was that in this case, a tremendous result was seen, and you can see the follow-up. It's a latest case of in 18th March, this patient came, and you can see from calcarea phos how the patient has improved, and the patient has got rid from the scalp psoriasis very, very fast. And you can see this was before and this was after. In very short time, the patient got relief, and the patient improved like, like magic. And this patient was suffering from psoriasis for very long. Now, because of this, she has got the quality of life of this patient has improved so much. Now you can see the before after pictures. In this, the patient was suffering from scalp psoriasis. The whole scalp, even the itching, dandruff has improved, the hair fall has reduced, and patient has got much relief in this case. And coming to the extensive case of psoriasis, this case I always show in my presentation, because in my life and in my presentation also, I have not seen a case of psoriasis, extensive psoriasis, as this one is. So I try to show this case in every presentation of mine. You can see the condition of the patient, how badly the patient is suffering. Even if forget about psoriasis, the patient is also having psoriatic arthritis, which is part of psoriasis. And you can see no body part is unaffected by this disease. And we all know psoriasis is it's a big stigma attached. Nobody even wants to touch you. Nobody wants to sit next to you. And you can see the condition of the patient, how the patient has suffering. Living a life like this, it's better to die. The patient's parents, the patient's family used to tell, Doctor Saab, this kind of life is not worth living. Let the patient die. This was the agony of the patient. This was the agony. You can see the condition of the patient, how bad this condition was there. And you can see no body part has been affected in this case. And physical generals were taken. And first, on the basis of acute totality, I gave this patient Kali Rs 30, right? And Kali Rs 30, after giving an acute totality, on the basis of acute totality, you can see the patient which did not come to the clinic, I just saw the photographs and I prescribed to his brother, and he gave the medicine to the patient. And then you can see from just Kali Rs 30 acute totality, the patient has improved, and the patient himself comes to my clinic, and you can see how the patient has started improving, how the lesions have started, clearing up. Now, after when the patient came to my clinic, then I took the proper case taking, and then I took the rubrics, and then I came across certain very wonderful higher mental symptoms, which I would have never got if I would not have taken a proper case. So from ailments from fright, delusion of snakes, fear of snakes, and dreams of snakes, higher mental symptoms. As we all know, if we know the ailment factor, if we get the right higher mental symptoms, the homeopathic works like magic. And in this case, when I came across this and a repertorization of only those higher mental symptoms I did, and from that basis, I just gave this medicine, because whenever we come across snakes, whenever there is fear of snakes, delusion of snakes, dreams of snakes, we always run towards our Ophidia group, like Lachesis, Laccan, and this. But in this case, this person was not a typical syphilitic kind of a patient. He was very confused. He was very, the totality, the constitution of the patient was very lazy, confused. Intellect was very poor. He was very he cannot take decisions, irresolute he was. And seeing the totality, just seeing the constitution of the patient, I prescribed Calcarea carb. In this case, Calcarea carb 1 mg was given, and you can see from the first follow-up, the patient has started improving. And just see his legs, how the patient has improved, and what was his condition was before, and you can see how much relief there is there in the patient. You can see before and after pics of this patient. The patient did not come to the clinic. I prescribed him Kalias initially as an acute medicine, then took a case, taken the higher mental symptoms and prescribed. And before after pictures are in front of you. The patient said that, Dr. Saab, you have given me the second life. You have saved me. This patient tried to do, commit suicide for 3 to 4 times. And I always show this case because this case gives a lot of hope to our homeopaths, what impact we can create in the lives of the others. Now you can see before after photographs, the quality of life of this patient has improved so much. Coming to the next case, psoriasis with secondary infections. You can see the condition. There is intense oozing, itching, silvery white scales. The patient cannot even go to the washroom, and the condition is so bad. The picture speaks for itself, and you can see what the condition of the patient is there. The patient is not able to come to the clinic, and I prescribed this medicines on the basis of my chat over telephonic conversation. I took certain rubrics, like timidity, yielding, irresolute, consolation aggravate, delusions are there, delusion talking to dead grandparents, cowardice is there, and perspiration, palms and soles. Perspiration, palms and soles were there. So fear of poverty and reprimand, sensitive to reprimand. So timidity is also there, perspiration, palms and soles is there. The patient is very fearful, delusion is there, and seeing the totality, I took the repertorization was done according to that. You can see Calcarea silicata came to be the first medicine, right? Was having the symptoms of Calcarea also and Silicea also. But it is wrong to prescribe if you are having two medicines, and you cannot combine like that, okay, unless and until it comes in the repertory chart, okay. In the same way, when in the repertory chart, Calcarea silicata came first, okay, and even the constitution of the patient was also of a Calcarea silicata, and a Calcarea silicata was given in this case. You can see how beautifully the patient the oozing has stopped, the itching has stopped, and you can see the flaking has stopped, and the bleeding also, even the voluptuous itching was there, bleeding was also there, but the patient improved like never before. And the quality of life, you can see how in the second follow-up, things have improved even much more further, and the patient got relief in a few days. And you can see the patient came to the clinic, and this is the photograph of the patient after that, okay. And you can see how patient has improved. All the lesions have gone. You can see the before condition also, you can see the after condition also, how the dramatic improvement in the patient has come across, okay. Coming one more case of this, see, psoriasis with secondary infection, one more case, and deep cracks, intense bleeding, enormous itching, and you can see oozing, watery discharge, pus, bleeding, and you can see the condition of the patient. She can't even go to the washroom, okay. The condition was there, and this patient was a teacher, and she used to go to a village in a primary school, and she could not even do her job. She can't even do her salary was even stopped because she was not able to attend the office, and various mental symptoms were taken in this case. But the main thing I want to tell you in this case was indignation was the main in this case. Indignation is, I want to emphasize on this rubric, indignation is against dignity, right? When you are forced to do things against your dignity, against your honor, in the same way, in this case, the patient where she used to work, her principal was, blatantly humiliated her. She was continuously hurt, and she was offended easily, and she was forced to do certain things which she was not willing of, okay. So she was against the dignities. There were certain things was there, like in this case, rubrics were there: ailments from indignation, ailments from anger suppression, egotism, abrupt nature was there. Anger does not express silent grief, fear humiliated of being, sensitive what others say about. This was the main rubrics which I took in this case. And you can see in the same way, this repertorization was there, and Lycopodium, Staphylococcus aureus, Natrimur, Ignatia, these medicines came up. Staphylococcus aureus is the prime medicine for indignation, okay, prime medicine. And in this case, Staphylococcus aureus was given. Second follow-up, you can see the third follow-up, fourth follow-up, and you can see before and after how beautifully the patient has got relief. So in the same way, I can tell you, in psoriasis, I've been working for psoriasis for very long. According to the World Health Organization, if a psoriasis case does not recur for 5 years, then only you can say it as a cure, okay. Otherwise, you cannot claim cure. Certain cases of mine are more than 5 years follow-up has been taken, and there has not been any recurrence. So these cases gives us a lot of hope to the patient of psoriasis. In the other case, you can see alopecia totalis. This patient came to my clinic and she started crying, and she was perfectly fine. I could not find why she was crying, okay. She entered my chamber, and then she removed her wig. I then realized that this patient was wearing a wig, and when she removed her wig, and she started crying like hell. and you can see excessive hair fall, silvery white scales, even the dandruff was there. And by default, in every case of skin, right, especially in a female patient, I get the thyroid profile done. So nobody did it before. This patient was coming from Meerut, and she but took a lot of treatment, but in this case TSH came across 11.12 in this case. So rubrics were selected: ailment, pregnancy after, suppression of anger, dominating, affectionate, egotism, offended easily, ambitious, desired sweets. You can see dominating nature, egotism, ambitious, and in the same way, when repertorization was done, lycopodium came to be the first medicine. And you can see lycopodium personality is there on your right side of the screen. This lycopodium wants to grow bigger. Okay, he's very dominating, he's very egotism, he's having a lot of he's offended easily, and a lot of he's very sensitive towards his self-respect. So lycopodium was given in this case, and you can see lycopodium 200, hair started coming out, follicles started coming out, and you can see slowly the hairs have started coming, and in every step there is an improvement. And just see where we started, and now the patient has totally recovered, all the hairs have come back, and we don't need any hair transplant, we don't need our patients to wear wigs, we can treat it by homeopathy by itself. Okay, one more case of now coming to the autoimmune disease. This is one more case of a vitiligo. Yes, 13 years old female. In a very short period of time, I want to show you maximum number of cases, just to tell the students and the doctors what homeopathy can do in dermatology. So this presentation of mine aims clearly that I want to share the importance of dermatology in our practice. And you can see in this case, there was a peculiar white discoloration on the picture speaks for itself. And you can see the small child, even the parents were so distressed because of the vitiligo of the patient, and repertorization was done. Ailment, death of loved one, grandfather. This was the main ailment of the case. Was done, and ailment was matching very proper. And you can see natramur, you can see 1M was given in this case. And first follow-up, you can see improvement has started coming up. Second follow-up, white spots have grown, have started reducing. And you can see third follow-up, almost white spots have disappeared. Before and after pics is in front of you. How beautifully we are, so many doctors are scared to take case of vitiligo, right? But I just want to show you what homeopathy can do in vitiligo. See, before after pics are in and we need to tell the society what other case of this you can see psoriasis of this patient. Just see the psoriasis. Psoriasis comes generally on the body first. It never comes on the face, right? But in this case, psoriasis was on the face. That is why I brought this case in front of you, because generally psoriasis is on the abdomen, on the back, on the extremities. On the face, it comes last. Okay. But in this case, you can see how this patient was suffering from psoriasis. And rubrics were selected in this case: grief, ill health of mother, long-standing grief. Mother was not well for very long. Brooding, loathing of life, forsaken feeling, dwells on past disagreeable occurrences, anxiety, anticipation, cannot cry in front of others, desire salty food, and sun aggravation. Simple rubrics, simple repertorization, and you can see the amazing result that is in front of you. See, this is important to understand. All this is evidence based. There is an evidence to whatever I speak. all the cases which I'm showing you of psoriasis, vitiligo, and these cases are well followed up for a very long time, right? So in this case, reporterization was done, and you can see how beautifully the aurum mur, natronatrum, and natramur, lycopodium, medorrhinum, thuja, various medicines were coming in the repertory chart. But as we know, our grief was important, loathing of life was there, dwells on past disagreeable occurrences, and especially I want to emphasize two more things. We tend to take mentals in every form, right? We tend to take mentals, and we emphasize on our mentals, emotions, mind. These things are there. But one thing we always forget is our physical generals are very important. See, my perception of mentals and your perception of mentals can be different. I can take certain rubrics, you can take certain rubrics, right? So mind and assessing the mind might differ, right? My reading and your reading can be different, right, of a mind. But the physical generals will always be the same for you also and for me also. So first of all, what mistake we do is we don't give importance to physical generals. So in this case, you can see physical generals were given importance: sun aggravation and desired salty food. If the patient is having desired salty food, it is for you also, it is for me also. That cannot change. If the patient is hot, it's going to be for you also, for me also, right? So that is like a milestone. You cannot change it. Mentals, our perception can change, but physical generals will never change. And physical generals will guide you towards your prescription, towards your constitutional medicine. That I want to emphasize. And where we do mistakes in prescription. Natramur was given in this case. This is the first follow-up. And you can see the third follow-up, the patient started improving in a very short period of time. And fourth follow-up, almost everything has gone and the patient has come back to the normal. You can see before and after photographs. So this is what homeopathy can do. One more case of vitiligo I want to show. Just see the young guy, young male, 26 years old. He doesn't even go to the college just because everybody laughs at him because of the white spot. When you are having vitiligo, when you are having psoriasis, nobody wants to touch you. Nobody wants to take a glass of water from you. Nobody wants to sit beside you. This is the amount of stigma attached, and that has been my inspiration to work on dermatology. And in this case, you can see grief, death of father, brooding, loathing of life, and in the same, cannot cry in front of others. This is important in this case. Natramur case, patient do not cry in front of others, like pulsatilla. She can cry anywhere, right? Natramur always goes to a secluded place, a closed room, and there he or she vents her emotions. So that is important to understand that in this case, cannot cry in front of others. Natramur was prescribed, and you can see repigmentation. White spots were there. Now repigmentation has started. You can see the brown islands. Even the pigmentation has started occurring. And you can see the third follow-up. Almost everything has come to to the conclusion, and the patient has responded very well. And you can see fourth follow-up. This is how the whole mark has, the white patch has reduced, and patient even the anxieties, the sadness has reduced considerably. And in the fourth follow-up, you can see every step photograph I'm showing you: first follow-up, second follow-up, third follow-up, and fourth follow-up, how beautifully the patient has resolved with vitiligo, right? In the same way, another case of vitiligo. This case is very important because just showing the photograph of before and after of vitiligo or psoriasis or whatever is not in this present in arena of scientific approach. We have proper scales to assess that how much extensive psoriasis is, how much extensive vitiligo is. So to measure that vitiligo, we use VASI scale, right? Vitiligo Assessment Scoring Index, right? I have done my PhD on vitiligo. My topic has been vitiligo. So in this case which I'm presenting, a very small girl, she was having VASI score 900, vitiligo assessment scoring index 900 was the case. And you can see timidity, bashful, consolation ameliorated, weeps easily, affectionate, desire open air, and thirstless. Simple rubrics were there. I just gave did the reportization of the simple rubric, because such a small child, you cannot get the mentals of such a small child. You have to ask mother, father for the rubrics, the nature of the patient. So in this case, reportization was done. Pulsatilla was given in this case, and you can see Pulsatilla 30 has worked wonders in this case. Just see the amount of improvement has come in this case. The first follow-up you can see, and see pre-Vasi was 900 and post-Vasi was 10. Just see, was my case of my PhD in which I did in my vitiligo. So Vasi score came from 900 to 10. This is the amount of improvement that has taken place. Now, coming to one more case of very amazing case of atopic dermatitis. It has been very tough case to deal with. This is a case of atopic dermatitis, voluptuous itching, extreme redness, and this picture speaks for itself. Such a small child, you can see atopic dermatitis is very difficult to cure. Very difficult to cure. It is so, the patient on one follow-up responds very well. In the second follow-up, there is aggravation. So there is so much of patients that even the doctor plus the patient also, they have to keep a lot of patience in this. The picture speaks for itself. You can see numeral eczema is also there. You can see behind the knees, there are the eruptions are there. Oozing is there. Itching is there. And just see the small boy is not able to go to the school. And what kind of life that this patient is having. Intense itching is there, intense oozing is there, and the condition was very bad. You can see the picture speaks for itself, and you can see how the patient was suffering for very long. And simple rubrics were taken in this place: mild, yielding, sensitive, consolation, ameliorate, desire of mental anxious, fear alone, fear of closed places, weeps easily. The boy was very claustrophobic, and he was so scared to even go to the washroom, and he never used to lock the washroom. He was so claustrophobic. Even when people are there with him in a lift, if the lift, he's so scared in going in the lift also. That much claustrophobic this patient was there, and weeps easily. Reportization was done in this case. Medicine Pulsatilla 30 was given in this case, and you can see slowly this patient has started improving. You will come across, you will see how the itching has reduced. This is the follow-up. You can see redness has come down, itching has come down. The patient is able to go to the school now. The small child now he's able to go to the school. Only the pigmentation has is left. Now the patient has improved very well by Pulsatilla 30, and you can see here much better the patient is. And you can see even the last photographs, even in the face, there were so many eruptions were there. And because this is atopic dermatitis, it's kind of allergy, and you don't know from what thing the boy is allergic from. Okay, so there's a lot of ups and downs in these kind of cases. And you can see the patient has improved, and the patient has come in the school dress also, which is coming from the school. And you can see the patient has improved so well. This is the fourth follow-up. The patient is much better. Before after pics are in front of you. Just see his legs, how his ankle was there. And in this case, you can see the back of the knee, things have totally dried out. All the atopic dermatitis lesions have been improved. And you can see one more case I want to show of extensive growth on foot. That is a warts. We call it warts as a very simple thing, but the patients suffer a lot with warts. In the modern medicine nowadays, what happens, the patient is always they cut the wart, they cauterize the warts so many times. And the experience is that once you remove if you remove one wart, hundreds of warts will come. You can see in this case, this patient was used to come from Haldwani, and the patient, how much he's suffering from the warts. And you can see the rubrics: art ability of, anxiety anticipation, fear of disease, act desire for, offended easily, fastidious, and the ailment from anxiety and anticipation. This was the rubrics taken, and you can see repertorization was done in this case. The patient was very artistic, was very, used to love music, used to paint a lot. And in this case, carcinosin 30 was given in this case, single dose, and you can see how beautifully second follow-up, third follow-up, and you can see before and after how beautifully the patient has improved. In the same way, there's one more case of vitiligo. You can see small child, very small child. You can just a girl child of 1 year and 2 months. The mother is crying. She doesn't know why, what is happening to the child. And you can see even the lips, upper lip, and corners of the mouth. The patient is suffering from vitiligo. Brex thinks, desire, heedless, careless, mood changeable, travel desired for, desire milk, desired sweets, grinding teeth during sleep. These were the main rubrics, because in the case of pediatric cases, it's very difficult to take mentals. So you just observe the patient, you just observe, and you can see, and you can ask the parents what it is. So grinding teeth during sleep was there, and very mood changeability was there. Okay. And in this case, after repertorization, we came to tuberculin. In this case, 30 was given in this case, and you can see the pigmentation has started, repigmented has started, brown color islands have started appearing, and slowly the patient has started improving, as if the god has started filling the white patches. It's so beautifully. You can see the follow-up, and this is the condition of the patient. Improved totally. This patient was improved. Before and after pics are in front of you. Evidence is there. Every case is full of evidence, and I take case in every step of dermatology. I take every follow-up. I take proper these cases. I must tell you that each one of these cases are very long cases. I'm just showing, because the time is very so limited. I'm showing it in a very short way. What I gave, what is the medicine, what was the repertorization chart. In short, I want to say this is the lichen planus case, and voluptuous itching in lichen planus. I tell you, diagnosis is violaceous eruption, violet color, which turns black later on, which dries and which becomes black. This is important. Intense itching. A lichen planus patient are very difficult to treat, because there is intense itching. And in this case, rubrics were taken: anger, traveling, contradiction, delusion, enemy, everyone, everybody is enemy. This was a delusion. And delusion, enemy surrounded by, I am surrounded by enemies. This was a delusion. He used to say in Hindi कि डॉक्टर साहब मुझे लगता है कि सब मेरे दुश्मन हैं, मैं दुश्मन से घिरा हुआ हूं. He was dictatorial, egotism, injures, fears to be left alone, irritability. He was very fast, hasty in his speech, suicidal disposition. And one more thing, mouth salivation, sleep during. This was the observation. And you can see repertorization was done in this case. The first medicine, syphilitic medicine. And what was the indication? Mouth salivation, sleep during. This was the main physical journal to indicate towards Muxol. And you can see Muxol was given in this case. You can see the improvement of this case, the pigmentation, the itching, the scaling, and the violaceous eruptions. Everything has improved. Even mentally, the patient is so much relaxed. Patient has improved, right? So this is important. Before, after pics are there. You can see. Coming fast to one more case, it's supposed to be acne, and acne is not easy to treat. It's very even the changes of temperature, even changes of your food affects your acne. And you can see what was the condition of this patient. You can see the clusters of acne, on the cheeks of this patient. You can see how the clusters are there on the patient. And dreams of unsuccessful efforts, missing train, missing exam. The patient used to tell me in Hindi, Doctor साहब exam छूट रहा है, मेरी train छूट रही है. Or this dream used to be very consistent all throughout. and indolence, obstinate, very nervous, mathematics, where he was very poor in, profuse perspiration, and desire eggs. See, this is the physical general which I was talking about. And you can see repertorization was done in this case. Calcarea carb came to the forefront because of dreams unsuccessful efforts is covered by calcarea only. And because of obstinacy, indolence, and mathematics inapt for desire eggs, calcarea carb was given in this case. And you can see the patient improved like never before. And the patient used, everybody used to make fun of him that what kind of, acne you are having. And we can see the before after pics of this patient. How beautiful. There's one more case of impetigo coming, showing you in a very faster way. Painful oozing, yellowish discharge, crust and pus formation. You can see the patient, the condition of the patient is so bad. Telephonic conversation was given in this case. And I talked to the mother and father, and you can see the condition of the patient. Young girl, hardly of 6-7 years, you can see. And company desire for cowardice, sentimental, and better open air, and important was desire to be carried. She was very sentimental. Just over telephonic conversation, what I could gather, I prescribed a pulsatilla 30, and you can see how beautifully this patient was taken to pediatrics also, pediatric doctor. He was also taken to a dermatologist doctor also. Okay, but in the last, homeopathy comes to the rescue, and you can see how beautifully the patient improved. And you can, before after pics are in front of you. So one more case, sebaceous cyst. How this case, this patient was having hard nodular cyst on the back, upper back, and since 10 years. And she, from every doctor, has advised her surgery. And one of her family members has advised her. So many people they have in our India. Everybody is a doctor. Everybody advises, right? So in this case, somebody advised her to put sumeg. There is a sumeg. It's a nitrate. You apply to that, and the pus comes out. It's a medicine. And in this case, you can see sumeg was applied, and see the condition of the patient. The red hot it has become, red hot. And the patient, excessive watery discharge, itching, burning, oozing, rawness, and fluid thin and sticky. Graphitis 30 was given in this case, just to subside, or this effect of sumeg which should go. So graphitis 30 was given in this case, and then this inflammation, this redness, then it came down, and then this patient improved. And you can see it has come to this level. Then this patient came to the clinic. I said, I took I measured it by my hand, just to see how big the cyst was. It was hard, stony hard, indurations, hard edges, having fascias, and it was on the left shoulder or upper back, right? So just being acute prescription, I just gave calcarea floor 30 single dose, and you can see all the pus, it was so foul smelling. The calcarea floor worked so beautifully. This nodular thing improved, and all the pus came out, and the patient improved like never before. And you can see before and after, the whole thing has reduced, and the patient improved very well. One more case I want to show you of, this case is having, you can see molluscum contagiosum. This case, the doctor went to a dermatologist, and you can see the marks. These marks were cauterized, removed. In this case, you can see even in the body, face, and rubrics were selected in this case. Impatience, weeps easily, quarrelsome, dreams host, dream dead people, and repertorization was done in this case. And in this case, we gave medicines, and Kali carb was given in this case. And you can see how beautifully the patient has improved so well. All the eruptions have reduced. The before after pics are in front of you, and you can see how beautifully the patient has resolved. One more case of, I just want to show you excessive herpes zoster. This is the case of herpes zoster. Okay, just see the intensity, what the patient is suffering from, how this patient is living his life. Just see the photographs. You know, in dermatology, photograph speaks for itself. We have photographic illustrations manual to understand. Dermatology cannot be taught, it can only be shown, right? So you cannot teach dermatology, you have to see the patient to diagnose. This is a herpes zoster patient. Anger, trembling, contradiction, disposition, delusion, enemy everyone around, and dictatorial egotism, hasty speech, suicidal disposition was very important in this case. And you can see Merxol was given in this case, and how beautifully oozing, excruciating pain has been better, and skin also, you know, has improved so well. Mentally also, the patient is much relaxed, decreased, anger has reduced. The homeopathic medicine affects you as a whole, right? Even in your mentals and everything, it improves a lot. So this is the follow-up, and I'm just making it very fast.
Yes,
Normal, you can see improvement is there. Before and after pics are there, and how patient improved. Even the normal skin has started coming up. So last thing I want to show it. I just have few messages to show to my students. This: surround yourself with people whose eyes lit up when they see you coming. Okay, this is very important to understand. We homeopaths should, work as a force to understand. We should appreciate each other's work. Second, slowly is the fastest way to get to where you want to be, and our slow efforts will only lead to our results. The top of one mountain is the bottom of the next. So keep climbing, keep improving, keep working for homeopathy, and take it to greater heights. And the last thing I want to show is, speaking is very easy. Anyone can dream it. Show the world that you can do it. And homeopathy, we should prove that homeopathy is the best medicine of, best thing that can ever happen to the society. Thank you very much for this valuable time, and thank you for letting me present my work. Thank you, International Forum, for promoting homeopathy. I hope to see you for many more sessions. I hope it was enjoyable, and thanks for the patience hearing. Thank you very
yes.
much.
Yes, sir. It is really an excellent session, a fire-breaking presentation from firecracking presentation from you, sir. Really, we really enjoy the beauty of homeopathy. You have shown how beautifully homeopathy works in whatever be the disease and whatever be the condition. Homeopathy can bring back the patient to normal. Not only bring back to normal, but also he can live in a peaceful way. Now I invite others for innocent. Now Sahani sir is there. Sir, please speak, sir.
Yeah, thank you, Dr. Dhanesh.
Hmm.
Now, Dr. Nishant has presented very nicely. I have heard him and watched him live during many of the seminars that he used to come to Patna and other places in Bihar. What the beauty of this dermatology, understanding dermatology, is better understood when you realize that there are the two index of the life. The first is the mind, and other is the skin. Because skin is the outer side, and mind is also on the outer side. So the direct reflections are there. So it is there, and he has nicely presented through the cases how the mind can affect very fastly. It is usually said that it takes long time to decide, but when you look very, and in almost all of the dermatological cases, it is important that we must have an insight into the mind of the patient, and listening and observations are very important for this. So I feel, Dr. Nishant, you have done well, and I hope you will be presenting more for the next session also. I will talk to you and let you know that things. Okay.
Thank you.
Hey, we want more presentation from Dr. Nishant Srivastava. Really, what a beautiful presentation, sir.
Thank you.
People can it can work in such a way in chronic diseases, isolation is, and now those and now I invite Dr. Ramparesh to say, sir.
Thank you, Dr. Dhanesh ji, और congratulations, Dr. Nishant Srivastava ji.
Thank you.
Very nice presentation, excellent session,
Thank you.
beautiful describe
Thank you. Thank you.
autoimmune disease, psoriasis, vitiligo, and impetigo, herpes zoster, and sebaceous cyst. According to law of homeopathic science, according to mental symptom is a very important symptom according to law of homeopathic science. और आपने बोला चिंता चिंता जो होती है वो चिता होती है है ना?
बिल्कुल
तो
बिल्कुल
बहुत अच्छा जो है, तो चिंता, एंजाइटी is the very role of disease, and skin disease, suppression, anxiety, fear, many kinds of skin disease and other disease. So very thanks, salute Dr. Nishant
My pleasure.
Srivastava ji.
My pleasure. Sir, I want to say
Thank
all
you.
these presentations I have individual. Psoriasis is individual, vitiligo is individual, alopecia is individual, lichen planus is individual. Whenever you time, tell me, I will show only one session only for one disease. Okay, I've got all this and published also. These all are published work of mine. Okay.
Definitely we can.
I am very glad. मुझे बहुत खुशी है. Thank you.
It's up to Dr. Hariharan, sir. Please unmute.
Hello.
Yes,
Hello,
sir.
doctor. See, very fine and highly commendable. Very nice presentation, and really we are proud of you.
Thank you.
Doctor.
Sir. All your blessings, sir. Thank you for blessings.
Very good, doctor. See, usually in our area, usually we say that the reflection of the mind we can see at your skin we can see the mind. So likewise, your case taking is very fine and fantastic.
Thank you, sir. Thank you.
Really, I am appreciating you. Okay, come again, doctor. Okay, thank you very much.
As the time is about to finish, now I invite Dr. Blomlim to say auto thanks. As you all know that tomorrow we will have a session from Dr. Sridhara Kurupal. So we'll be talking about anxiety and homeopathy. Now it's up to Dr. Blomlim to say auto thanks to Dr. Nishant Srivastava.
Okay, thank you, Dr. Dhanesh and Dr. Nishant Kumar, sir. It's a very brilliant presentation tonight. As we approach the closing of this 1304th uninterrupted webinar of IFPH, I will express my deepest sincere thanks to Dr. Nishant Kumar, sir, for your absolutely brilliant presentation on evidence-based clinical study on homeopathy dermatology. And you have presented many different cases of dermatology, which is very informative for all of us. And also thank you for your encouraging words for us to carry on and learn more from each other. And once again, I would like to say thank you very much on behalf of IFPH, and hope that you will continue to share more of your experience in the near future. Thank you very much.
My pleasure. My pleasure. Anytime.
As you all know that this is a continuous process, and we need Dr. Nishant Srivastava to present more and more subjects, and definitely more and more cases. All cases were brilliant. I hope all of you enjoy the beauty of this night from the presentation. And with that, we come to the end of the day. Thank you all. Thank you, sir.